Hello viewers, thank you so much for joining me on this channel. In today's video, I will discuss how to obtain informed consent. Obtaining informed consent is a station that one can encounter during MRCS ENT OSCE, or this can be a station that one can expect to encounter in other ENT OSCE pattern exams. With the advent of new regulations in the MBBS curriculum, even MBBS students can be tested on how to obtain informed consent for a surgical procedure. Let's discuss this in more detail. The single most important thing that one needs to keep in mind while obtaining informed consent is to pause and check if the patient is understanding what we are saying or not. A typical sequence in which one can communicate with the patient to obtain informed consent is described here. The communication begins with introducing yourself and confirming the identity of the patient. It is a good idea to explore at the very outset what the patient already knows about their condition. It is also a good idea to explain the disease with relevant details about the anatomy, to tell the patient exactly what is going on with them, and only then should we move to the steps of the surgery, including the type of anesthesia. It is very important to mention both the benefits as well as the risks of the surgery, and it is also important to mention any alternatives, if present, to the surgical treatment of the disease. It is imperative that we tell the patient about the post-operative precautions they have to observe following the surgery. At the end of the entire discussion, we should summarize the discussion, ask if the patient has any more questions for us, and thank the patient for their time. It is very important to assure the patient that they can sign the informed consent then and there, at a later date after discussion with family members, and they are well within their rights to change their minds even after signing the informed consent. Let us discuss this with the help of an example. In this question, there is a 40-year-old patient who requires endoscopic sinus surgery for removal of sinonasal mass from his left nasal cavity. Let me be the examinee who is supposed to obtain informed consent for this procedure. If this was an MRCS ENT OSCE, then I would have 7 minutes to obtain informed consent. Please time me. Let's start. Hello, I am Dr. Puspen Dasgupta. I am one of the ENT doctors in this hospital. Is it okay if I talk to you for some time? Could you please tell me your name and date of birth? How may I address you? Thank you, Tom. So before we proceed, Tom, could you please tell me what you already know about your condition? Thank you for telling me that, Tom. So I understand you are aware of the fact that you have a tumor in your left nasal cavity that requires to be removed surgically. Okay, so I'm going to tell you about the steps of the surgery, the benefits that we aim to provide by performing the surgery, the potential risks of the surgery, the alternatives to surgical treatment if there are any, and the precautions that you would need to observe in the post-operative period. After listening to what I have to say, if you feel like signing the informed consent right now, then you are free to do so. If you want to discuss it with someone else and want to sign it at a later date, that is also perfectly fine. Also, if you sign the consent now and change your mind about undergoing the procedure, that is also okay. We will always respect your wishes. During this discussion, if you want to interrupt me and ask any questions, please feel free to do so. I'll be more than happy to answer all of your questions. Can I proceed, Tom? So Tom, our nose is divided into two parts by a midline partition which we call septum. our nose is also surrounded by air-filled pockets, which we call sinuses. In your case, Tom, unfortunately, there is a tumor in your left nasal cavity which is extending into one of the sinuses. This needs to be removed by performing a surgery. Do you have any questions for me, Tom? This surgery is performed under general anesthesia. You'll be completely asleep during this procedure. If you have any questions regarding anesthesia, our anesthesia doctor will be happy to answer them. This surgery is performed without making any cuts on the skin. We will use an instrument called telescope to look inside your nose, and with the help of other instruments, we will remove this tumor from your left nasal cavity. After the surgery, we will introduce dressing material inside your nose to prevent bleeding from occurring. Presence of this dressing material can lead to the feeling of blocked sensation in your nose. Also, it is worth mentioning that you will have to fast for a few hours before the surgery and after the surgery. The exact duration of fasting will be intimated to you after admission. Do you have any questions for me? The dressing material would stay in your nose for about 1 day, so you would have to spend 1 night at the hospital. We will remove the dressing material from inside your nose the next day, about 24 hours following the procedure. Do you have any questions for me? The benefits that we aim to provide by performing this surgery is we aim to completely stop the recurrent episodes of bleeding that you are having. We will also be able to understand exactly what disease you are having by examining the removed tissue under microscope. Do you have any questions for me? As is the case with most surgical procedures, there are some risks associated with this one as well. The most common risk associated with this surgery is the possibility of bleeding following the surgery. However, in most instances, the bleeding is not severe. We will take all necessary precautions to prevent bleeding from happening, and even if it does happen, we will take all the necessary measures to stop the bleeding as soon as possible. Can I tell you about some rare risks associated with this surgery? In about 1 in 500 cases, problems related to the eye are noticed following this surgery. As you know, the nose is very close to the eye. It is separated by a thin plate of bone. If there is injury to this bone, there can be bruising around the eye, which usually goes away on its own. There may also be swelling around the eye, leading to double vision, which is a very rare condition, and we will take all the necessary precautions to prevent this from happening. In very rare conditions, there may also be loss of vision in one eye. Again, we will take every necessary step to prevent this from happening. Another even more rare complication of this surgery is noticed in 1 in 1000 cases, where fluid surrounding the brain is seen to leak from the nose, because the nose is separated from the brain by a thin layer of bone. This thin layer of bone separating the brain from the nose, if it gets injured, then the fluid surrounding the brain can leak out from the nose. But again, this is seen only in 1 in 1000 cases, and we will take all necessary precautions to prevent this from happening. Do you have any questions for me? Following the surgery, you should take leave from work for about 1 to 2 weeks, and you should avoid strenuous work for 2 weeks. For about 1 week, you should avoid blowing your nose, and if you do sneeze, try to keep your mouth open when you do it. We will teach you how to clean your nose appropriately with an appropriate solution, and please clean your nose as often as we prescribe you to do so. This will help you recover as soon as possible. Do you have any questions for me? So just to summarize, I have told you about the steps of the surgery, the benefits, the risks. In terms of alternatives, there is no alternative to surgery, but if you choose to not undergo the procedure, we will respect your wishes, but we will strongly recommend that you do undergo the procedure. There is no alternative treatment in this case. I've told you about the precautions, and if you have any questions, please ask me. If you want to sign the consent now, you can do so. If you want to sign it later, that is also fine. And if you sign the consent now and change your mind later on, that is also perfectly fine. Thank you so much for your time. So this is how you should approach informed consent. This is how you can obtain informed consent from the patient. I hope discussion with the help of this example helped you. If you have any questions, please feel free to ask me in the comment section below. Thank you so much for watching this video. I hope you liked it. Take care, and I hope to see you again in the next video very soon.